To stay alive, we breathe, eat, and drink. To sustain our existence in this world, we have sex. Most of us here are a consequence of two people having sex. Having sex is part of human nature. We have sex not only to have babies, we have sex to express our love and affection. We have sex to feel pleasure and intimacy. But living within us are a range of microbes that are associated with our different body functions. Some microbes are essential to our health. Some microbes are harmful, like microbes that cause sore throat, diarrhea, or skin infection. Some microbes we get when we have sex. This can cause discomfort and discharges in our genitals. There are about 40 different microbes that can be transmitted sexually. It is estimated that there are about 357 million STIs acquired every year. And this is only for gonorrhea, syphilis, trichomonas, and chlamydia. There can be many more STIs acquired. Do you know that in 2016, these STIs were all-time high in the US alone? 1 million STIs are acquired every day. In the time that I have been speaking, there are about 500,000 people having sex. Sadly, they're not here, but sadly, about 2,000 of them have now a new STI. STIs can be very serious, and sometimes we don't even know that we have them. These STIs can cause pelvic infections, infertility, fetal and newborn deaths, complications in childbirth and pregnancy, and cervical cancer, to name a few. STIs should not be treated differently like any other infection. And most importantly, we cannot sweep them under the carpet and pretend that they don't exist. They're all around us, and they're more common than you think. But we don't give them enough attention. Instead, we stigmatize people with STIs, we neglect their care, and what's more, we fail in prevention. This is a serious problem. There is a documented case of a pregnant woman in Haiti. She was screened for HIV, which is part of her routine prenatal care, and he was managed appropriately. However, she wasn't screened for syphilis, although it can be done at the same time with the same blood sample. The mother gave birth to a baby that is HIV-free, but the baby died a few days later due to complications of congenital syphilis. If only syphilis test was done with HIV tests, the mother could have been treated for syphilis, and the baby could have been born free of HIV and syphilis, and the baby could have survived. HIV is a sexually transmitted infection, but it's the only STIs that we talk about. In the 90s, there are plenty of information and education to reduce the stigma against HIV. Do you remember the film Philadelphia? Yes? That's, Tom Hanks played a role of a person living with HIV. He even got an Oscar award for this. Those of you who belong in this era could also recall the massive sex education and condom promotion. So what changed? STIs are increasing. Why aren't we making headlines about STIs? Should we do anything any less for STIs? We cannot have proper prevention, diagnosis, and treatment if we pretend that STIs do not exist or we don't talk about sex. I was once in a clinic in Asia. A patient came to me because he was worried he had an STI. He took some medication which his friend suggested, but the symptoms did not go away. Initially, he was so hesitant to talk about his sexual partners. I examined his penis, and there was nothing wrong. Then I examined his anus, and there was an anal discharge. Thank God he came to me. I was able to treat him. We discussed about healthy sexual practices, his barriers on condom use, and how to address these barriers. And in the end, he was determined to use the condom when having sex. Many patients with STIs are so ashamed to seek care. And many healthcare providers do not openly talk about STIs and healthy sexual practices. Because we've been neglecting STIs for a long time, they are now getting difficult to treat. Gonorrhea, a very common STI, is becoming resistant to the last antibiotic treatment. If we don't develop new drugs, it's gonna be an issue because then you'll have so many side effects and consequences of this. This is an urgent issue. Imagine a world where STIs are treated like any other infection. This is the world I want to live in, wouldn't you? To make this world, we now need to have an open and a stigma-free discussion about sex. Think about driving. We want to be safe in the road. We learn the basics of driving and how to drive safely. We put on the seatbelt, we follow certain rules, and we obtain a driver's license. Why can't we not do the same for sex? If we want to be safe and to enjoy a fulfilling sex life, we need to know the basics, be comfortable with our sexuality, and we need to know how to be safe and to be responsible. Being responsible will allow us better health and better relationship. Think about the many TV programs and radio shows out there that talk about food. Many talk about what to eat, how to cook it. Wouldn't it be great if we had more TV shows and programs that talk about sexuality and healthy sexual practice in a more positive way? So, what can you, yes, you and I, can do about it? We are all in this together. I am a healthcare provider. For us, it is important to normalize the discussion about sex and to reduce the stigma. I may be a patient too, and as patients, we need to be more open about our sexuality so that we can receive appropriate care. I am a mother too, and as parents, we can help our children understand the basics of sex. But I can tell you, it's not easy. You know, I'm a professional, I know about STIs, I know about safer sex, but to talk about sex to my children, it's difficult. I had to watch a video to learn how to talk about sex to them. My son, when he was 10, he approached me. He was so worried. He was holding this condom. I had several boxes in my house. And he said to me, "Ma, why is this condom big and my private part is small and it is not fitting?" And I said to my son, "Don't worry, my son. Time will come, your private part will grow, and the condom will fit, and you will make someone very happy." This is very important. It can save your life. If you use this condom properly, it can prevent you from having babies, having STIs, and having HIV. Sex is part of life. and so are STIs. Together, all of us here can do something to reduce STIs and at the same time have fun and pleasure in our sex life. Policymakers all over the world, just like driving, make sex safe. Please make sure to reduce the stigma. Do not cut the budget on STI and HIV prevention and sex education. Better still, increase it. For doctors, nurses, and midwives, treat STIs just like any other infection. Do not be the source of stigma. People in the media, you can really make a difference. Give us more shows on sex education. Parents and teachers, wherever you are, be open and ready to talk to your children and students. You'd rather be the people talking about sex to them rather than them learning it from pornography and in the internet. Educate yourselves on the latest trends among teenagers so that you can speak their language. You read the news, right? Isn't it news? Do you know the latest trend among teenagers? It's called sleuthing. Sleuthing is when, at the middle of having sex, they remove the condom. You know, this can be harmful and it can be violating some of your rights. All of us, for those who choose to have sex, be rational, be responsible, be safe, and have fun. Use a condom correctly. For those who have STIs and who think they have an STI, don't be ashamed. Go to your doctor. You should not be the one, and make sure that you don't transmit the infection to others. I am now at the end of my talk. By now, there are about 2 million people who have had sex. Sadly, the people who have an STI have increased from 2,000 to 8,000. Let us stop the pain and suffering. Let us stop the serious consequences and death. Let us stop the stigma and discrimination caused by STIs. But let us have a fun, fulfilling, safer sex life. Thank you.